a bruit in my neck, what would I do? First of all, I'd define what a bruit is. A bruit is an abnormal sound that a doctor or a caregiver hears with a stethoscope, just like we listen to the heart. And that sound suggests turbulence or changes in blood flow. That might mean that there's a narrowing in that artery. Specifically, when you listen in the neck, the artery that we worry most about is the internal carotid artery. That's the main artery that takes blood from the heart directly to the brain. So if that's heard, the first thing I would do would get a carotid duplex ultrasound exam. This is a simple, painless, non-invasive test using Doppler, just like the Doppler you hear the weather person talk about on the nightly news. And it actually detects speeds of blood flow. The faster the speed of blood flow, the more narrow the artery. That'd be number one. Number two, I would remember that hearing a bruit in the neck automatically signifies an increased risk of heart artery disease. So I would speak to my doctor about my risks for potentially having heart artery disease. And if I had risk factors that weren't effectively being treated, I would suggest that they be treated. Based on the results of the carotid duplex ultrasound, I would then determine what would be the next steps. So if there weren't blockage, then it's a sound that we hear from other things as well, thyroid gland, veins, things that aren't worrisome. If there is blockage, but it's not severe, then I would aggressively treat risk factors to lower the risk of that progressing and getting worse. If it were severe, I would ask to be seen by a specialist in vascular disease who could help determine what the appropriate therapy might be. The risk based on carotid artery stenosis is largely based on how severe the narrowing or stenosis might be. If it's greater than 70 or 80%, the risk of having a stroke is significantly increased over the same patient who doesn't have that degree of blockage. So that'd be the greatest concern. But in addition, finding that narrowing in the carotid artery also signifies the potential for artery disease in other arteries as well, like the heart, legs, kidneys. And so we always think about that. Certainly a severe stenosis in a carotid artery warrants at least more aggressive medical therapy to prevent progression or worsening of that blockage, and maybe even a procedure to reduce the amount of blockage that's there. The treatment options for carotid artery blockage depend on how severe the blockage is. So we'll start off with those patients who have some blockage, but it doesn't reach 50%. In those patients, the treatment is entirely medical. And that means that the cholesterol, blood pressure, blood sugar, smoking issues are all addressed so that we lower the risk of that going from less than 50% to greater than 50%. In patients who have a greater than 50% blockage and who have been unfortunate enough to have a symptom already from that, like a transient episode of blindness, trouble getting the words out that one would want to say, weakness or numbness of an arm or leg, those patients clearly need to have a procedure to reduce that blockage. That procedure might either be a surgical procedure in which the artery is opened and the plaque removed, or a stent procedure in which a stent is placed directly inside the artery to alleviate the blockage. If the blockage is more severe, it's greater than 70 or 80%, even if the patient's never had a warning sign or symptom from that, many physicians will consider that procedure, either surgery or stent, to lower that blockage risk.